Maddie, and today I'm going to be interviewing my mom, Mrs. Abbott. Hi, Mom.
Hi, Madison.
Okay, I'm going to ask you some questions. What's your occupation?
I'm a physical therapist.
What's the name of the company you're working for?
I work at Charlton Memorial Hospital in Fall River.
What type of industry is it? Manufacturing, retail, computer?
It's a medical facility.
How did you first become interested in the kind of work you do?
When I was in school, I always really liked working with people, and I liked sciences, so I went to my guidance counselor and tried to figure out what I could do that kind of incorporated both of those things.
What are some prior jobs you had to this one that led you to this position?
I was a rehab aide for a number of years. I volunteered in a hospital, and then I went to college for it.
What type of education, training, and licenses did you need?
I went to Northeastern University for 5 years, and I got my bachelor's degree in physical therapy. Then I went back to school and I got my master's degree in rehab counseling. So I have a bachelor's in physical therapy and I have a master's in rehab counseling. So I have a Massachusetts license as a physical therapist.
What kind of things do you do on your job? Describe your job.
I work with people in the hospital setting. I work with a lot of people who have just had surgery. So I teach them how to walk with crutches. I teach them how to walk with braces. Sometimes people have had new knees, new hips, open heart surgery. We get them up right at the day after they have their surgery. So I help a lot of people get back into their homes or go to rehab before they can go home.
What's a typical day for you?
Typical day, starting with my children? No, you want to know about my job. When I go to work and we get a list of patients that we need to see for the day and we go up to the floors, we go through medical charts, finding out what people have had done. We look to see if they've been medicated. We go down and we meet with the patients. On any given day I could see between 8 and 10 patients.
What are the working conditions of your job? The setting, the hours, the travel, the risks?
From my house, travel's about a half an hour. Parking in Fall River is probably the biggest challenge that we have in terms of going to work. Can you ask me a couple of those again?
The setting, the hours, the travel, and the risks.
The setting is in the hospital setting, so I go right up to the floors in the hospital. The hours, I have a wonderful boss, so I can flex my hours at work pretty well. I generally work during the school year. I probably work from like 8 to 4:30. During the weekends, if I tend to work a weekend, I might work like 6 to 2:30, so I can go in very early because we get patients up very early to walk. The risks with my job, it's a lot of lifting. So the piece that I have to do, you have to know how to lift. You have to trust the person that you're lifting with because you can get hurt lifting. You can hurt your back. You can hurt other parts because sometimes patients can't cooperate. Sometimes they are medicated and they don't know what they're doing. So that's probably the biggest risk.
What do you like most about your job?
I like helping people. I like working with people. I like helping them and seeing them the first day and they maybe can't get out of bed, and by the time they're ready to go home, they're able to walk again, they're independent again. They are very appreciative of, some people can't believe how difficult it is to move after you've had a surgery. So seeing people get better and go home.
What do you like least about your job?
Sometimes some of the people who are very sick sometimes aren't going to get better. We see a lot of people who have been diagnosed with cancer, who have had amputations because they've had infections and they lose their leg, or they've had a stroke, and sometimes the stroke is so bad that they're not going to get better. They may have cancer. We see a lot of brain tumors. So sometimes when people can't get better, it's very difficult.
What are some of the benefits that your company offers, either in-house or out of office? Are you able to do things with this job that are advantage to you that you couldn't do with other jobs?
I guess being in the medical field, we have a lot of access to doctors, to other healthcare people. So if there was something going on, whether it's within our own family, people that we know, there's a lot of people that you can ask questions of. There's a lot of learning. There's a lot of things that are coming out new in medicine that we actually get to see right from the beginning. When I've worked at the hospital on and off for 20 years now, and they didn't have patients who had open heart surgery. Everybody had to go to Boston, so that's something that's really big in this area now. We see people who have had open heart surgery, we see them day after surgery, get them up walking, and some people get to go home really quickly.
And I know you have like outpatient and stuff too for like the people that come back and stuff. That's neat.
So in with the piece that I work in, for the therapy, we don't have outpatient at the hospital anymore, but we have a couple of satellites, and that's nice too because we also get to go into that setting if we want. Madison actually has had therapy with some of my friends in the outpatient clinic, so that is really exciting because she gets to see what I do on a daily basis, but actually it's gotten better and it worked real well.
What's the size and the location of your company?
It's a hospital. It's a very big hospital. I think we have about 350 beds. The location is Fall River, Massachusetts.
Like how many employees do you have? Does South Coast fund?
South Coast has 3 hospitals, but if you're looking at just Charlton, I think there's probably about 400 or 500 employees. I could be wrong on that, but there's quite a few.
What type of technology, software, or hardware do you use to communicate at your company?
We do use computers, but the biggest thing that people will laugh at is we use alphanumeric pagers still. So all of our orders come through on a little beeper that people don't even use anymore. I know everybody has their smartphones, they have other things, but we still use beepers. So if Mr. Jones needs therapy, the hospital, the unit that he's on will send an order through the computer, and that will come to my beeper and say, Mr. Jones in room 3010 needs to have therapy, so I will go in and see Mr. Jones.
That's cool. If I wanted to be in this career, what could I do to enter this field and get some experience now?
To get some experience now, I've had a lot of kids actually from Aponequid and some other schools come and volunteer. They've come and observed for the day, so they've come around to the different floors with me. We have some kids that will come and they'll follow like somebody from the lab. They might follow a nurse. They might follow a respiratory therapist. So we're always willing to take people in so that they can see what the different fields are like. Because even when I went to school, Northeastern had a co-op program, so I got to see the field a lot before I went out to work. And that's what I had asked when I went to college. I said, what if I don't like it? What if I'm in it for 2-3 years and then I don't like it when I get out? And they said, oh, no, we have co-op. You get to see it right away. The second year you're in school, you get to go out, work in the field. And that gave me a lot of connections on jobs when I was going to get out of school. People had offered me jobs all along the way. When you finish school, come back and work for us. When you finish school, come back and work for us. So Northeastern's a great school for that because you get a lot of hands-on training.
Are there any classes in high school I could take to prepare myself for this field?
The biggest thing that you should take in high school is any science course you can, because you need to take all of your sciences when you get into college. Physics is one of them, any biochemistry, anatomy and physiology.
Okay, and your final question, do you think you would ever switch jobs or careers in the future? What would you want to do and why?
In terms of switching jobs now, going back to school, I probably would not. I have my master's. I absolutely love what I do, love going to work every day, which not many people can say. I really do like what I do. If I were going back now, I may be a physician's assistant. It's a little less schooling, probably a lot more money. Probably not as much hands-on as I get with patients in interaction with people every day. The physician's assistants, in order to be a doctor, it's a lot more schooling and would take time away from a family. But as a physician's assistant, you get to work with patients closely, but for very short periods of time. As a therapist, I get to see them ongoing until they're ready to go home.
That's good. I'm glad you like your job. Thanks, Mom.
You're welcome.